Gastrointestinal tract infections. The gastrointestinal tract is made up of the mouth, esophagus, stomach, duodenum, jejunum, ileum, colon, and anus. The gastrointestinal tract is home to a plethora of bacteria known as normal gut flora which aid in the digestive process. Normal flora of the GI tract includes but is not limited to lactobacilli, E. coli, and Bacteroides. Outside the gastrointestinal tract, all of these bacteria can be potentially pathogenic. Infections of the gastrointestinal tract are mostly caused by the ingestion of pathogens through contaminated food or water. The pathogen must enter in sufficient quantity so as not to be destroyed by the highly acidic environment of the stomach and its enzymes. Symptoms include watery diarrhea, abdominal cramps, nausea, and vomiting. Pathogens cause disease by rapid multiplication, toxin production, and even invasion of the mucosal epithelium, which causes its destruction and can lead to systemic disease. For example, Salmonella uses a type 3 secretion system to inject host cells with effector proteins as shown in this simplified diagram. A common name for gastrointestinal tract infections is gastroenteritis, which describes the inflammation of the stomach and intestines, commonly resulting from infection caused by either bacteria, viruses, or parasites. Subgroups of gastroenteritis can be classed into three main groups. The causative pathogens are listed. They are non-inflammatory diarrhea, invasive or inflammatory gastroenteritis, and food poisoning or intoxication. Other causative pathogens of gastroenteritis are included on this slide.
Application is a 3-day procedure. A brief outline of the procedure has been demonstrated here. On day 1, we have been provided with stool sample from the site of infection. Therefore, a gram stain cannot be performed directly from the stool sample as there would be numerous flora present in the gut, and therefore it would be difficult to distinguish between normal flora and pathogens. Day 3 will be in the results. Day 1 and Day 2 have been combined, and we have been provided with pure growth plates to carry out gram stain rapid tests and biochemical tests. In the following slides, I will describe how each test of the methods can be interpreted to identify the causative organism. The first test is the gram stain. It helps classify organisms by their gram staining, shape, and arrangements. Then come the rapid test. It further classifies the organism. The most important part of the method is the agar media. Media help isolate pathogens through selective and differential ingredients. The following solid media are used for isolating gut pathogens in conjunction with liquid media, MSB, which provides enrichment to grow Salmonella, whereas APW provides enrichment or alkaline environment for the growth of Vibrio on TCBS. Now, how we are going to interpret what we observe on plates. So most gut bacteria are gram-negative rods. We look and compare horse blood agar and McConkey agar. If both have equal growths, it is indicative of Enterobacteriaceae. On XLD, it is selective media for Salmonella and Shigella. Plain pink colonies will be indicative of Shigella, whereas black centered pink colonies is indicative of Salmonella. Salmonella can be further identified by culturing on chrome agar. TCBS isolates Vibrio species, and this agar is also known as Yersinia agar, and its characteristic red bull's eye is indicative of Yersinia species. Finally, the CCDA is the isolation for Campylobacter, which can be further identified by antimicrobial susceptibility test.
Campylobacter can be identified by the following chart. To confirm the ID of the organism, we use some biochemical tests which includes API20E, API20NE. Other methods can be used for the identification includes PCR for molecular detection and serology test for Salmonella serotyping and Vibrio cholera. No sensitivities are done for the GIT infection because most of the GIT infections are self-limited and resolve within few days.
The results showed that all bacteria present throughout the cases were gram-negative rods, and they all showed growth on McConkey. We've broken these cases down into two groups, the non-Enterobacteriaceae family, including cases 1, 5, and 7, and the Enterobacteriaceae family, including cases 2, 3, 4, 6, and 8. Of the Enterobacteriaceae organisms, the ones found in the case studies were Yersinia enterocolitica, Salmonella, Shigella, Plesiomonas shigelloides, and Edwardsia laetata. Something to note, that for Plesiomonas shigaloides in case 6 is that it was the only organism that was oxidase positive, which would mean using an API 20 Ne as opposed to an API 20 E for identification. Of the non-Bacteriaceae organisms, the ones that were found in the case studies were Aeromonas hydrophila, Campylobacter jejuni, and Vibrio parahemolyticus, of which all were catalase positive and oxidase positive. It's important to note that Aeromonas hydrophila found in case 1 is an S. chapum organism. This will induce a flattening effect when in the presence of a beta-lactam antibiotic and is indicative of antibiotic resistance to beta-lactam antibiotics. It therefore needs to be treated with either cefotaxime or imipenem.
In conclusion, we can say the clinical symptoms are the initial identification for gastroenteritis from the patients. Different selective media were used to isolate pathogenic bacteria from numerous gut flora. Sometimes these bacteria and viruses are multi-drug resistant, so the development of the multi-drug are becoming more challenging to discover. Non-typhoid Salmonella are most predominant cause of illness compared to the other bacterial species. So more control program should be done to reduce the risk of salmonellosis. Quality control is crucial for accurate identification of microorganisms. Therefore, it should be maintained effectively for high performance. The corresponding slides are showing the lab report and doctor report for case 2, which has been identified Yersinia enterocolitica.